All right, we'll call the Health and Human Services Committee meeting to order. And then the first order of business is to accept the minutes of the January 31st, 2024. Motion by Sam, second by Dana. Any discussion? All those in favor? Aye. Opposed? Motion passes. Now we have department requests and reports, and we'll start with Social Services and Tammy.
Good morning. Thank you, Chairman Mullen. It's my pleasure to be here today. I'm Tracy Hudson. I'm the Director of Administrative Services within the Department of Social Services. Commissioner DeLorme asked me to present today while she attends a strategic planning meetings for the New York Public Welfare Association. We have two agenda items today. The first item is budget amendment request. And we're looking basically to providing a cleanup of our 2023 accounts following the practice that had been previously discussed with the treasurer. With this resolution, we are asking to move approximately $920,000 to cover spending in 3 appropriation accounts. The accounts that have shortfalls are daycare, service for recipients, and safety net. We will provide a fixed numbers in advance of the Finance Committee meeting, which is why we marked section 4 of the form as we have. The variance in the budget is due to having budgeted based upon trends seen in 2022 and the reality of what transpired in 2023 with the financial eligibility of the residents we are serving. We are estimating that the amounts transferred to daycare will be approximately $205,000. Service for recipients will require approximately $72,000, and safety net will need approximately $640,000. We are suggesting that the funds to offset the shortfall be pulled from Medicaid, family assistance, child care, state training school, Code Blue, and emergency aid for adults. These appropriations have remaining funds available for the transfer.
Question I have is funds that are being decreased. Will that in any way affect the services in those areas?
No, it will not.
Yes, sir.
So Chairman, this is going to be just a reclassification between expense accounts for last year. Since last year books have been closed, we know that these are the final numbers. So this would just be a motion to send it to finance for the reclass between one of our accounts.
So it's just 2023.
Yes, sir.
Okay, thank you.
I'll move it.
Good, and a second. Any other discussion? All in favor?
Aye.
Opposed? Motion passes. Next.
Our next agenda item is staffing pattern amendment. DSS and ADRC currently have 2 computer operation coordinator positions. And we also coordinate with county IT for a member of that department to be stationed within our office space. The county IT position is funded through monthly billing from county IT to DSS ADRC that has been approved for reimbursement through claims to the state. This request is to decrease the DSS staffing pattern by 1 computer operation coordinator. It is my belief there will be a request to balance the decrease made by Terry McNall. We will plan to prepare another agreement and seek the approval through the state to cover the cost of this new shift.
So, motion to approve the staffing pattern amendment.
I'll move it for discussion.
Second. Good. Discussion.
Yeah, so I know Terry's here, so are we relieving the one that's in IT? It's not gonna be there anymore, or? It sounds like we're losing one, so I was just curious as to which one we're losing, because we gotta go and ask for more funding.
Transfer from DSS to IT.
Okay, gotcha.
Not really getting rid of the position, it's just coming out of the DSS staffing pattern, and then IT is gonna ask to add it to theirs.
Gotcha. So what? I'm confused there because I thought we had one of her personnel that's down there
We
now.
do. Now there'll be two.
Then I could have two.
Uptake. Yeah.
You can come up.
Okay.
I just thought maybe I could add a little clarity of the bigger picture, of kind of what we're talking about, that might help everybody a little bit. So, DSS has been changing over the years in terms of their support. When I first started here, they were really completely segregated on the state network, and they really had to have people within their own department to manage their systems. As time's gone on and COVID changed the landscape of technology and the way that we use it, including social services, they've moved to what's called a VDI platform, which is a virtual interface. And they're trying to put, in a good way, move everybody to the VDI platform, which is actually taking the computers, the imaging and the requirements for the state network away. And so throughout the entire state, people are moving the social services platform under county IT. And the big picture and long-term picture will really be that county IT will be supporting the hardware, the internet connection, and then the state will support the virtual desktop interface, which could be accessed from anywhere. So it's a bigger picture transition, that's beginning to happen. And after discussing with Tammy and Tracy and, everybody, they had a resignation in that department. And with the VDI improvements that they've made over the years, we really feel now is a great time to start making that transition. So what we're looking to do is in a bigger picture is to backfill that position, the computer coordinator position, with a position in IT that's a help desk position, to then have the MOU with social services like we have. So we have two instead of one, in terms of the reimbursement. And they would be dedicated to DSS, but they would also do county IT. It'll make it a much better configuration for us to support, because we'll then have remote access to the computers. And we started the testing for the VDI interface and the way that we'll be reconfiguring that network. So
I was just trying to follow the ball. I lost it
Yeah.
completely, so. I'm good with it, we're good.
The bottom line is I don't think there's any kind of budgetary effect with this, because the funding is still gonna come out of DSS, even though the position's gonna live within IT, because you'll have an MOA with DSS.
that's correct. Yeah, so there shouldn't be a budgetary impact, and it's going from a grade 18 to a grade 16 also in terms of the position that we're looking to fill. So it's a slightly different role
That'll be discussed more.
And
in personnel. Yeah.
my only request for the committee to consider would be to make any motion that you're in favor of contingent upon the state approving the MOA. Because if we move the position and then the state decides that they don't want to approve the MOA, we shot ourselves in the foot and made it a cost of Terry with no reimbursement, where it was a reimbursement by the state before. So I would make any change contingent upon the approval of the MOA by the state, so that you don't know funding it.
So we'll add that to the motion. Sure. And my next question is, does this have to be referred to the personnel committee?
Yes.
Okay. So we add that to the motion as well. Any other discussion?
Great job handling all those acronyms. It's like this last stuff. I'm on it.
All those in favor? Aye. Opposed? Motion passes.
So I said I lost the ball.
Good, thank you.
Let's not frisbee, so.
Okay.
Okay, ADRC, Gina?
Morning, everyone. Well, I'm excited to share with you that March is a time where we highlight the importance of proper nutrition as we age. And we do this with our annual campaign called March for Meals. At this time, I'd like to share with you that the theme for our March for Meals campaign is called Connection in Every Bite, which highlights one of the most important aspects of our senior nutrition program, which is the profound relationship between food and social connection. In 2023, Office for Aging, in partnership with the Sheriff's Office, served 925 individuals with approximately 92,554 meals. On Friday, March 22nd, we are inviting the Board of Supervisors, elected state legislators, the Office for Aging Advisory Council, and select department heads to see the operations of our central kitchen, to enjoy a ride along with one of our seasoned home delivery meals drivers on a meal route, and to also visit one of our dining sites. I have with me today a letter that includes all the details of the day's events. If this day does not work for you, if the stage invite does not work for you, most certainly you can accommodate a different day, a day that works better in your schedule. So at this time, we hope to see everyone on March 22nd. RSVPs are most certainly welcome, and I'm available if anybody should have any questions.
Thank you.
I do have a couple items for miscellaneous. I'd like to share with the board that the Washington County Office for Aging has again been randomly selected along with 300 AAAs across the nation to participate in the Administration for Community Living's National Survey. We've been advised that our participation this year is vital so that ACL can have national representation to support ACL's congressional budget request. The company initiating the nation's survey is called WestApp. Like last year, a select group of Washington County older adults will be sent by mail a survey, and the data collected from those surveys are going to be reported to the federal committee. Are there any questions around the national survey?
Can you remind me again on what ACL stands for?
I'm sorry, Administration for Community Living.
Thank you. You probably said that, I just missed.
May not have. So thank you. Again, another acronym. That's what, yes. Lastly, I'd like to share with you that the agreement we have with NYBT Media for the publication of our Community Connections newspaper supplement expires on April 31st. Our office has started the process of seeking quotes from local newspaper publishers. My hope is that at March's committee meeting, I'll be able to share with you who will be receiving the award of this service.
You know, if they are going to,
Submit a proposal. At this time, I'm assuming they want to continue. We definitely have evolved over the last year in our program with them. In terms of, a lot of the minute details and structure of the paper. And so I hope is that they will also continue, but we have received so far a quote from one other publisher in the area.
Thank you.
thank you.
Good have a day.
You too as well. Veterans, Ken?
Morning, everybody. I just wanted to take a few minutes to invite Jeremy up here to update everybody on the Adirondack Cures Care program. He's got some different events and updates that he'd like to share. So without further ado.
Good morning, everyone. Thank you for the invitation. A lot to cover. I feel like it's been a while since I've been here. So we are, the Adirondack Cure Period is updating the website. We're in the final stages right now to make it a bit more user-friendly. We're able to track our data a little bit better, RSVP for events, especially those that have a cap for attendance. So just be on the lookout for that. We're going to send out a blast as soon as that's completed. Our MST group, which we started over at St. Anne's, it's meeting twice a month. It's gone very well. As a matter of fact, we're actually trying to see if this is something that the rest of the Dwyer programs across the state want to roll out. We spoke with the Saratoga folks, the Dwyer Foundation down there, and they, the VA assisted them with theirs, but it was a virtual meeting. And as I had kind of guessed that it would be kind of a flop because with such sensitive topic, I think a virtual presentation, virtual counseling is not very effective. Rather difficult to kind of read body language and determine when folks are feeling uncomfortable or where the discussion should go through a monitor. So we're doing ours in person. We capped ours at 8. It's full right now. It's currently full. So which means that if we get more interest, we're going to open up another session. They've been fantastic over there. As a matter of fact, I have a meeting with them next week to just have a somewhat of a debrief of how it's going, what we can change. But the women that are participating love it. They're attending every other week, and it's gone very well thus far. So we're very pleased to report on that. The vehicle purchase through state OMH has been approved. We're in the final stages of getting that through, figuring out, who's going to own the title and insurance and all that type of stuff. So that's looking forward to having 2 vehicles attached to the program so we can better serve our veterans throughout Warren and Washington County. Be on the lookout for that as well. A big initiative behind the Adirondack peer-to-peer one we took on quite early was supporting our veteran-owned businesses. One of the things we're trying to do is get the hyperlinks to the websites on our Adirondack peer-to-peer because whenever we patronize a business, we're looking to use veteran-owned businesses first, because even if nobody attends, you still help the veteran. So as far as we're concerned, that's a worthwhile initiative. We have several Washington County events that have gone quite well. Our monthly informational dinner at Drumbelly's over in Fort Ann has gone very well. We're pretty much at capacity every month. We had to skip last month's dinner because there was a death in the family. Jeff's sister passed away, unfortunately. But otherwise, we've had great speakers coming out, topics ranging from healthcare for veterans, nutrition, physical training. We also have a retired, I believe he's an Army warrant officer that lives in Argyle now. His wife, who's I think she's a nurse practitioner. Anyway, she has a cryotherapy business that she's trying to start. Gave a demonstration using myself as the guinea pig. It went very well. Strong response, especially from veterans who are looking to treat certain injuries with a non-surgical route. So they were quite pleased to see that I could move my shoulder much better after the treatment. Went very well, and I think we've given her a good launch because they just moved from Alabama. He just retired not too long ago. So hopefully you have an opportunity, the members, to welcome them to the community. They love it up here. They're very pleased to be living in Washington County now. Our auction barn breakfasts have gone very well. We're averaging about 42 per event. Very well received from the folks. Delicious breakfasts. It's just a great event. Our Whitehall and Greenwich stewards, modest attendance. We're considering shifting our. Remember the purpose behind those stewards breakfasts was to kind of catch veterans as they're walking in, buy them a breakfast sandwich and a coffee to get them to introduce them to the program. Not necessarily a planned event where folks show up and enjoy, which we do get sometimes, but really it's more to catch veterans who perhaps aren't connected via internet or social media. So it's an opportunity to meet our mentors face to face, give them a calendar, give them a brochure, and then do some very cursory, we'll say superficial triaging, see if there's anything that we can help them with in that brief instance, and then hopefully we'll see them at other events.
Chairman, just a question, how do you know they're a veteran?
So now our so especially the Greenwich stewards, even at the Whitehall stewards, those folks behind the counter know the veterans. They come in pretty much on a daily basis anyway, so they're like, okay, this is a veteran. But what we do is we have it's a little plastic stand, clear, translucent, and we say, hey, if you're a veteran, coffee and donut or coffee and breakfast sandwiches on us, and we have a table set off to the side where they come over and meet our mentors, and we keep a log of all the food that they've consumed, and then we pay at the end of the event. So sometimes we miss some because it's difficult. You don't want to sound like an insurance salesman badgering these folks as they're at the counter, but the ladies behind the counter are usually very, very helpful, pointing out the veterans and saying, hey, the coffee's on us today, on this gentleman over here, and then they come to us. So
Thank you.
So we might shift locations. We might move to Cambridge and then maybe Hartford or Argyle or something like that, just to see, because we're, not that we're saturating the market, but, you know, the Whitehall folks, they certainly know about us, and the Greenwich folks certainly know about us as well. Cook is all set for Memorial Day weekend. Please let your veterans and family members know that this is locked and in the books. It was an outstanding event last year, and I think any reluctance that some veterans and family members may have had, like, oh yeah, a free event at Cook, yeah, okay, well, it went very well. I have a meeting with them next week to see if we can just finalize what type of activities that we're gonna hold. We are gonna make a concerted effort this year last year it was like a free-for-all, and there's so much to do there that, you know, veterans were scattered all over the place. This year, we're gonna have more planned activities, and especially a formal Memorial Day event where I'm really gonna kind of build it around the poem in Flanders Fields, which is, if you haven't read it, it's outstanding. Very, very good. So we're gonna, you know, talk about, really kind of go around the campfire and talk about some of our comrades that we've lost. And I expect it to be an outstanding event again. So just, you know, let those veterans know that you come in contact with, to be on the lookout. Registration is going to be coming out soon. And also we have our Call of Duty tournament coming up next month. And I know this might sound strange, but I've talked to quite a few parents of veterans, and they're saying that they're younger veterans. This is our target audience, that they're in their basement playing video games or withdrawing from society. So one of the things that we said, hey, let's meet them where they are. And we hosted an event in December. We had 5 attendees, which wasn't great, but you know, we had some prizes for the first, second, and third place winners, and everyone walked away very happy. Now we've got the gaming club on SUNY Adirondack helping us facilitate the event, and it went very well. We're right in multi-purpose room. There is a significant prize, a $500 first prize if you take first place. So really what the goal is to say, hey, we're not selling you a bridge in Brooklyn or, you know, swampland in Florida. We're really here just to help, hey, connect with other veterans. And we've expanded it a little bit. So we're going to have a Wii station for the kids. So in case that veteran is like, I would have gone, but I've got my kids tonight. Well, we've got a Wii station set up over here so they can play a game as well. Plus, we're going to have board games for veterans my age and older who don't necessarily know how to play Call of Duty but can play chess. So we'll have food there. It's going to be an outstanding event. It'll be on March 22nd. So we already have some registrants already. So if you come across any veterans, especially our younger veterans that are a bit more tech savvy and play, you know, their PlayStation and Xbox and stuff, have them come out. It was a great event in December. We're going to do this quarterly, again, to make connections with those younger veterans. And you know, we're looking forward to hosting you again. Any questions for me?
Thank you.
I just like to comment, Jim, and the job from Don and Ken and Rob York for helping to get this set up and established and moving the direction it should be going in. I still involve deeply in the veterans community throughout the Tri-County area. And there's a lot of good comments, positive comments that are made about the peer-to-peer program and about the Washington County Veterans Service Agency in general. So, you know, you guys are a good reflection on our county, and the veterans certainly appreciate all that you do. So thank you very much.
No, I appreciate it, Sam, and I know I kind of grafted on top of the Vietnam Veterans of America, but I think that we've made a lot of connections with quite a few Vietnam veterans who want to participate now. And it was as simple as going to Beans, who tremendous business. They are very veteran friendly. So thank you for the opportunity, and you know, please, of course, if anybody sees a veteran in need, if there's something that I can help with, please let me know. Don't hesitate to reach out. That's what we do.
Thank you.
All right, thank you.
Thank you.
All right, next, mental health.
Yeah, excuse me, just Chairman, I see on here there was a thing about a vehicle purchase.
Yes.
When you talk about vehicle purchase, it's under veterans, I don't know.
Oh, okay.
I've got it, okay, sorry, Rob. I'm trying to steal your thunder.
So really, that was my only item.
There you go.
Just to provide an update that, for those that don't know me, Rob York, Director of Community Services, for both Warren and Washington counties. The reason that I had this on my agenda today is because the funding for the peer-to-peer program, Veterans Peer-to-Peer, flows through the Office of Mental Health. It flows to my office on our state aid letter, like the rest of our other state aid. And to give a little bit of history, back this was prior to the award of the RFP to SUNY Adirondack. The counties tried to keep this position in-house. And there were some gaps, went through a number of coordinators. And so there were some unspent funds. And then in 2022, sort of mid to late year, we developed the contract. We had issued an RFP and we developed the contract with SUNY Adirondack. And in great thanks to Jeremy, the program's really taken off and done well. But prior to that, there were some fits and starts and some unspent funds. And so the program identified a need for 2 vehicles. And so we made an appeal to the Office of Mental Health. They haven't closed out 2022 yet. Funds, some of those funds were unspent funds were still available to us. And so we applied to them for the purchase of 2 vehicles. Program is going to be able to purchase a Hyundai Palisade and a Subaru Legacy. 2 vehicles totaling almost $82,000. And what we want to do is just make an amendment to the contract that would state that if the vehicles would follow the program. In other words, if we discontinued the contract with SUNY Adirondack, because they will purchase, title, insure the vehicles. If we were to change vendors, the vehicles would change, revert back to the county. And I don't know if we need a resolution to do that. I was going to defer to Tampa here. So do you think we need a formal vote to amend the contract in that
It
fashion?
wouldn't hurt to have a resolution to have the chairman sign right now.
I believe so, yes.
So we have a motion to refer to the chairman, the vehicle purchase.
Move it.
Second. Any discussion?
Yeah, I would just like to point out that originally the Adirondack Community College had said that they could utilize, peer-to-peer could utilize a vehicle there. But it was always, 3rd or 4th in line. Adirondack's needs came first. So there were many times that they couldn't fulfill what you wanted to do.
First
Yeah,
serve.
first come, so first serve. So, this really will enhance their program so they can do all the things they need to do and keep a schedule, get some of the veterans where they need to be for different types of stuff.
And it's a shared program between the 2 counties. The vehicles would be used by the program for whatever needs across the 2 counties.
All those in favor?
Aye.
Opposed? Thank you.
All right, that's all I have. Thank you.
Next, we have McAllister, Tina.
Morning, everyone.
Oh, no, I think that's.
That's mine.
You can look at the same.
Let you check that one area.
The UV rays.
Okay, the first thing I have on the agenda is request for overnight stays. I did see that there was a change where we wouldn't have to get approval if it was within 60 miles and it was in our travel plan, but these are not within our travel plan. So I just wanted to get permission for those. The first one is the statewide immunization conference. We'll have our supervising nurse and one of our vaccine coordinators attend that. It is in Albany. It's from May 16th to May 17th. And the cost of the conference and the travel and hotel and things like that are all covered by the New York State Association of County Health Officials. So there is no cost to the county other than the car getting there and back. So just looking for approval for that overnight off.
And all those in favor?
Aye.
Opposed? Motion passes.
The second overnight is actually for myself. It's at the Harm Reduction Symposium, also in Albany. And it runs from June 4th to June 5th. And again, this one is also covered by NICHO. The cost of the conference and the hotel are all 100% covered. Just looking for approval for that.
Motion to approve that overnight. So second. Okay, all those in favor?
Aye.
Opposed?
And then our third one is actually out of state. So I believe it's my understanding that has to go to the full board for approval. It's for the National Immunization Conference. This is not something that we've attended in the past, but we would like to attend this year. It goes from April 8th through April 11th. And this, the expenses related, it's in Philadelphia, Pennsylvania. And all the expenses for this conference are all covered under our COVID vaccine response grant, which was, we had to request for those expenses to be covered under that grant, and they did give us that approval for that. We do have quite a bit of funds left within that grant, and that grant expires in June 30th. So we're looking for approval. It would be our clinical nursing supervisor who would be attending that. So we're looking for approval to attend that conference in Philadelphia.
So we want a motion to approve and move to the full board. All those in favor?
Just this discussion for,
Sorry.
it's probably eligible, six, I don't know, or maybe Danny knows, or somebody's been along me. Why do we have to do it differently for going out of state? I mean, somebody goes to Rutland, Vermont, technically they're supposed to do with it. What's the proof of that? Is it insurance or it's just policy we made up?
Just a policy that was made.
Okay, I was just curious as to what was driving it.
It's a policy passed by the board, it's in the travel policy area.
If it's something you want to look at in the future.
Well, I just wonder if there's a reason for it. I mean, you know, you can go out of state here and be closer than if you went to New York City. So I don't understand.
The wisdom of the previous
Yeah,
generation.
there you go. That's kind of where I'm at. Thank you.
Any other discussion? All those in favor?
Aye.
Opposed? Motion passes.
And then we also had applied for a scholarship through the National Association of County Health Officials for two of our staff to be certified in infection prevention and control. We were awarded that scholarship. So I did talk with the personnel officer yesterday and just to run it by her to make sure that there was no issues with that. And she didn't foresee any issues with that. It would really be just further the training. I do have to sign a letter of acceptance of the scholarship. And it would be our Director of Patient Services, Eliza, and also our infection control supervising nurse. Where there's a series of training that they have to go through and then there's a test at the end that they would have to take. But again, that is all reimbursed through the National Association of County and City Health Officials.
So the scholarship covers all of those?
Yes, correct. So just looking for approval to sign that letter of acceptance.
Okay. Any discussion? All those in favor?
Aye.
Opposed? Motion passes.
Thank you. I do have a couple program updates. Our certificate of need was officially approved to move to Burgoyne, which is great news. It was approved last Friday. There are contingencies attached to that, of course. One of them is submitting the check for $1,600, which I believe we've worked that through with the treasurer to request that check. That's for the construction fee related to the project. The other conditions that they have, just a couple of the major ones that I wanted to point out. The project must be complete by June 15th of 2025, including the pre-opening process. So once we're ready for them to come up and inspect it, they will come up and inspect the area and give their final approval. Also in the letter, construction needs to begin by August 15th of 2024. And construction needs to be completed by March 15th of 2025 in order for them to come up and do their review before that final date in June. So it's more for awareness. I have shared the information with Matt Jones and also Melissa. So he can take the next step with that. I do have to go in to the application itself and sign that we agree to meet these conditions and contingencies. I have not had a chance to talk to Matt at this point, but obviously I'll talk to him first to make sure that's a realistic timeframe before I go in and sign those conditions. So just more awareness for you that it's moving forward.
Just a quick question. What kind of, upgrades are gonna have to be made in that project?
In that, we've been over there a few times. Definitely where our immunizations are gonna be stored, need some major, we're gonna put in a few clinic rooms, where we can do that, so, and I don't know the HVAC system as well. Matt had mentioned that, needing to be upgraded. I think they've already done the roof. Yeah, so there's different. And then right now it's set up as classrooms over there. It's just a bunch of classrooms. So making those into more, efficient office space, for us.
Scott, I think if you had the opportunity to stop over to public health and see where they are now, you would see the need for it. Then you could see the bigger picture as to all of the room that they really need.
I've heard tell of the need.
They're great.
Yeah, the last couple of months has been a little tricky over there.
I was wondering, last time I was there was probably a year ago, so maybe it's been done. The bathrooms were not handicap accessible.
Mhm, and I believe.
Those haven't been done.
Yes,
It's been
yes.
upgraded.
Right.
And that's something that the state will look for as well when they come in, and they'll ensure that all of that is up to code. Next thing I know I mentioned it last month, but, the Village of Cambridge last night did approve the installation of a harm reduction vending machine, at their library in the village. That I just got word of that this morning. I believe the mayor still has to sign, the paperwork related to that. But just so you're all aware, that will be also moving forward, pending, the mayor's signature on that. And that is something that's being done through, Adirondack Health Institute and the Alliance for Positive Health. And they're hoping to have that installed, at some point over the summer. So
What is a harm reduction?
So
machine?
it's going to include, stuff for, overdose response. So it'd be Narcan, testing strips, things of that nature.
Okay.
And they are going to be doing a press release on that. AHI, they did let me know that this morning as well. So just so you're aware of that as well.
Yeah, and then also some like personal care, personal hygiene type items as well. So.
The next thing, just for your awareness, and I will send this all out to you after, we were approached by the National Fitness Campaign. And they actually did a virtual presentation for us. I don't know if you've seen it in the media, but there was one installed down in, Albany County. They have funding and working with, MVP Health Insurance to install an outdoor fitness, court. So it's a whole presentation that they do. It would really be something that would be related to like your individual town. It's something that you're interested in. So I will send you the information. There is funding available for that, but if there's also, a matching, contribution as well. So I'll send that out to all of you in case any of you are interested. I'll send it to all the supervisors, so they're aware of it for their town. Okay, so I'll send that out. I just wanted to make sure that you were aware of what I was sending. The next thing, I'm sure you've all heard of the 1115 waiver, which is something that's funding that the state is going to be receiving from, the federal government. Really, if you remember the district project that we had, several of those before COVID, so quite a few years ago. It's very similar to that. It's more going to be focused on community-based organizations and, making sure that people's social needs are met, in order to create them from having negative health effects. So, I did receive with that application, the state was split up into regions, very similar to what it was before. We are included in the North Country region. So we would like, each region is gonna have a social care network that's, the state is gonna award based on their applications. I did receive, the request to sign a letter of support for the Adirondack Health Institute. They're going to be applying for our region. And I'm just looking for permission to go ahead and sign that letter of support, with the Adirondack Health Institute. We had the same type of, relationship with the district project. And then as well, they help us with our community health assessment, they help us with our, community health improvement plan. So I'm just looking for permission to sign that letter of support so they can submit that with their application.
So a motion to allow Tina to sign a letter of support for that application. And Nate? I'll second. Any discussion? All those in favor? Aye. Questions? Question?
I'm sorry, just to interject, I'd like to propose a motion to allow other Washington County department heads to also sign that letter of support. Our office also received the request, and with our working relationship with AHI, of course, with public health, we also this part network at AHI.
Okay. So a motion to allow other agencies to sign the letter of support. Second, all those in favor? Aye. Opposed? Thank you.
And the next thing, the Public Health Fellowship Program, as we know it now, which right now the fellows are considered to be our staff, is going to be ending as of June 30th. The state is proposing a new fellowship program. They're calling it the Fellowship 2.0 program. So this one will start August 1st, and it's going to be set up differently this time, where the fellows are not going to be county employees. They're actually going to be through PCG, Public Consulting Group. So we have been allotted 2 fellows to join us. It would be for a 2-year program. It's really very similar to an internship. We wouldn't have anything to do with paying them. Their workers' comp would be, everything would be through their health insurance, would all be through PCG. They would really be stationed at public health and working on projects that we would assign them for the 2-year period. It's really to build up the public health staff. And there is no commitment to the two people after the 2-year commitment. So we're just looking for, I'm looking for approval to sign. I have to sign a letter of intent by the end of this week in order to accept those fellows starting in August. So I'm just looking for approval to sign that letter of intent.
Motion to approve it, and second, Sam. Any discussion? All those in favor? Aye. Opposed? Motion passes.
Thank you. And then the last thing I have, we did receive a health advisory from the New York State Department of Health relating to measles. We actually received that at the end of January. They've updated it since then. There are no cases in New York State outside of New York City. There are cases in New York City, but none outside of New York City at this point. But I just wanted to make you all aware that they did send that advisory out for providers to be vigilant for cases of measles.
Thank you.
I think that's all I have.
Okay.
Okay, thank you.
Well. Okay, other business. Other business.
I just want to comment, I feel like I've been beat up on this morning. Before I had before I started, I had 2 little Hershey bars, and then Gina lectured us on nutrition. You know? And then Tina had the physical fitness thing and looks right at me and says, "You gonna nail something out?" Man. It's been a tough morning, yeah.
You know, other business. Yes.
Chairman, one of the items that was sent here from finance, I believe. Yes. Was the request by Elite for additional $20,000 for their food pantry. And we wanted some time to kind of review the numbers that were presented. So I did meet with the director and her fiscal officer, and I got some updated presentations. Get up to the committee and so that So again, if you remember, I just wanted the committee to have a broader picture of the program. What you do with the information, of course, is always yours, but I wanted to make sure that you had a more deeper dive into what the actual numbers were. I definitely like this presentation a lot better. Hopefully it's helpful to you. The last presentation we got was just the money that they sliced out specific to our county contract. This representation is of the program as a whole. The only thing that I would note is in the food pantry inventory line, $15,413 of that is in kind, not actual dollars. But you see the offsetting revenue below. So it's an increase in the expense and an increase in the revenue. So the $23,000 loss is still the loss. But the actual dollars out the door are 31,676. Like I said, it doesn't change the loss of the program, but the in-kind is, are like donations and stuff, not direct dollars, just to give you the background on the difference there. So I'd give this to you for your review, and then the other thing that they let us know that I think was important information, the $20,000 that they're asking for wasn't a permanent $20,000 increase. They think that there's some short-term hurdles that they need to get over, and Melissa, I think what Melissa had talked about, maybe just a one-year contract, do it for 1 year, and then come back and review how the program looks and how the future of that program might look for going forward. So if you were to take action on it, it would be the $20,000 or some number that you decide given to the program for a 1 year basis to review. And
I guess my question is probably for Shelley. Shelley, I know you asked for 20,000, but your program shows a deficit of 23,884. So you're gonna be about $3,900 short of that. Where do you plan on making that up? Is there some place you're gonna find that, or should you really be asking for 24?
Great question. We are increasing our actual fundraising efforts and looking at other grants to support as well. And the hope is, as you said, we're looking at this as a bridge, really, while we're looking to overcome some of those other hurdles, and would love to just have more sustainable funding that is not county dependent.
My only concern was that you're still gonna be another $4,000 short of what you projected here.
And so there's kind of a three-legged stool here. There's the county funding, there's the CSBG funding, and then there's the grants from the regional food bank.
Yep.
So we've also asked the director to take a look at, my understanding is when we combine the two food pantries together, LEAP did not request an increase in their grant. So Tammy in the past would have got a grant for her side, and they would have got a grant for their side. So LEAP is gonna look into the fact to see if they're entitled to any of what used to go to Tammy now that the food bank is combined. So that could be a potential, that could be an increase there.
Okay.
And then the CSBG funds, this is a part of a bigger award from CSBG. So if they had to rededicate some of the CSBG funds, there might be an opportunity there too.
Gotcha. Okay, makes sense. I was just trying to figure out
So
what.
we should all feel the pain of the deficit, not just the county.
Gotcha.
So Al, are you suggesting that this committee at this time could make a motion to move $20,000 into this, or?
So the ask of LEAP is for $20,000. If this committee wanted to take action on that number or some number in
And
between
refer it to finance.
and refer it to finance, that's what Shelley would be looking for at this
And
time.
the 20,000 comes from where?
Great question. That's for the budget officer and finance committee to decide.
Okay,
I have recommendations, but.
Okay. Just so we know.
Yeah, currently it would be a fund balance barring any other,
Okay,
magical mystery tour, but,
so is there a motion to move $20,000 to LEAP to cover their deficit for 1 year?
Yes.
Okay, a second, Sam. Any discussion?
Jim, I'm sorry.
Okay, move it to finance.
And with the understanding that the year that we're talking about is 2023. By the time this gets in front of the full board, it will be March. So I would want that understanding to be that the 20,000 be retroactive back to January, that we make LEAP whole for the 3 months that had gone by. But if this is passed by the board, then it'd become effective January 1st, so that they're entitled to the monthly distribution that they would have got at that level.
All right. Any other discussion? All those in favor?
Aye.
Opposed? Motion passes. Any other business? Motion to adjourn. And we're adjourned. Thank you.
Thank you.